Welcome to the Piedmont Healthcare System. We are delighted you've chosen Piedmont for your joint replacement surgery. We are dedicated to making your healthcare experience the best it can be, returning you to independent living and to an improved quality of life. This video presentation has been created especially for you as you prepare for your joint replacement surgery. We believe the more information you have about your procedure, the more empowered you will be to actively partner with us in making your surgery and recovery a success. In this presentation, you'll learn how to prepare for your surgery, what to expect during your hospital stay, and what you can do during your recovery to achieve your best results. This information is designed to supplement instructions from your surgeon and the printed materials you will receive, which detail your treatment plan for your particular type of surgery. We are committed to providing you with all the information you need to become an expert about your care. Studies have shown a more informed patient will have better outcomes, including a lower risk of surgical site infection and readmission.
Hey there. Thank you for coming.
Good to be here.
Yeah.
We also encourage everyone to attend Joint School, a free class offered at the hospital where you are having your surgery. In this class, you'll have an opportunity to meet some key healthcare professionals who can answer your questions about how their specific roles will help you in your recovery. You'll also meet other people who, like you, are preparing for joint replacement surgery. You'll get to hear their questions, concerns, and input about how they are preparing for surgery. Being well prepared for this surgery can help you not only with things like managing pain, it can affect your overall outcome and ultimately allow you to more quickly return to your active lifestyle. There are a number of preparations to make before you have your surgery. One of the first things we suggest you do is designate a coach. This can be a family member or a friend, someone who will provide support, especially after your surgery.
Well, 5 more.
They can encourage you to follow your therapy and recovery instructions, assist with meal planning, and help with other activities of daily living. Approximately 1 to 4 weeks before your surgery, you'll have an appointment to meet with your surgeon. At this meeting, your surgeon will explain the surgical procedure and any risks involved, and also answer any questions you have about your surgery. In fact, it's a good idea to write down any questions ahead of time and bring them to this appointment. Once your surgery is scheduled, your surgeon's office will arrange an appointment for pre-surgical testing at the hospital. This appointment will usually take place 1 to 3 weeks before your surgery and may be scheduled for the same day as your preoperative visit with your surgeon or in conjunction with Joint School. This time frame can vary slightly depending on at which Piedmont facility your surgery is being performed. The staff at your surgeon's office will clarify these arrangements and appointments for you. When you do come for your pre-surgical testing appointment, please bring with you a list of all the medications you take on a regular basis. This should include over-the-counter and prescription medications, vitamins, and herbal supplements. At this appointment, you will have a thorough health assessment that may include tests to make sure you are medically cleared to undergo surgery. A nurse will ask you questions about your medical history and about medications you are taking. They will examine you, checking your blood pressure, taking blood samples, and gathering important information about your health. All of this information will be compiled in your medical record, so each member of your surgical team can review it prior to your surgery. The best surgical outcomes occur when you, the patient, are as healthy as possible, closely managing any chronic conditions and your stress level prior to your surgery. The pre-surgical testing nurse will share with you some critical information, including specific instructions about what not to eat and drink immediately before your surgery, which of your medications you need to stop taking, and which ones are okay to take with a sip of water on the morning of your surgery. Also, on the day of your pre-surgical testing appointment, you will meet with a hospital representative who will pre-register you for your surgery and hospital stay and help to make sure all of your paperwork is in order. At Piedmont, our pain management program is successful in controlling post-operative discomfort because we are very responsive to your needs. Before your surgery, it's important to practice at home rating your pain. When you are in the hospital, we'll be asking you often to rate your pain level using a scale of 0 to 10. 0 is no pain, and 10 is the worst pain you can have. Being able to assign a number to your pain or discomfort is not easy, but it will help the hospital staff better understand and manage your pain. With good communications, the team can make adjustments to make you more comfortable. Also, in the days leading up to your surgery, you'll want to review all of the information you have received, including the guidebook that shows you what exercises you need to be doing before your specific surgery. 1 or 2 weeks before your surgery, you can do these exercises 1 or 2 times per day. Practicing these exercises beforehand can help make them much easier to do when you are recovering after surgery. If any exercise causes extreme sharp pain, skip that exercise and work on the movements that don't cause as much discomfort. You can see video demonstrations of proper knee and hip replacement exercises on our website at www.piedmont.org/orthopedics. It's also extremely important before your joint replacement to prepare your home ahead of time so that it is a safe, accessible, and comfortable environment for your return after surgery. For example, you will likely use a rolling walker for the first week or 2 after your surgery. So it's a great idea to plan out how that's going to work in your living space. Start at the entryway of your home and notice how many steps there are to enter. Are there stairs to get to the main level of your home? How many stairs are there to get to your bedroom? Are there secure handrails at each stairwell? Which side are the handrails on? You should measure the height of your bed by backing up to the bed and noticing where the top of the bed meets the back of your leg. These are all things the physical therapist will ask you and teach you to navigate before you leave the hospital. You'll want to prepare your sitting areas as well. Check your favorite chair. Are you able to get in and out of the chair easily? Most people find having a chair that sits higher and has arms on each side makes getting up and down much easier and safer. If you need to raise the seat, you can add an extra cushion or place folded blankets under the existing cushion to raise it to a more comfortable height. Your personal care and activities of daily living are important too. Getting up and down from the commode can be difficult if the commode is low and there are not handrails to pull up on. A 3-in-1 commode chair may be recommended. This is an adjustable seat that fits over your existing commode and has arms on each side, which allow you to easily lower and lift yourself. This commode chair also comes with a container that can be placed inside it so that you can have the commode next to your bed if you have difficulty getting safely into the bathroom during the night. The third function of this chair is to place it with the seat closed inside a freestanding shower so that you can sit down when showering. Contact your insurance provider to find out your cost of both the commode chair and the rolling walker. Many people find they are able to purchase these items from a thrift store or borrow them from family or friends if their insurance doesn't cover the full cost of a new one. It's also smart to place items you use frequently at an easy-to-reach height. Bending over may be restricted for a period of time to allow your new joint to heal. Having items at an easy-to-reach level increases your safety while you are recovering and regaining your strength and balance. Plan your meals in advance, too. You can purchase prepared meals or make your own meals ahead of time if you don't have someone to assist you with meal preparation and shopping. The majority of our patients do recover at home and receive in-home or outpatient physical therapy. Occasionally, a patient does not adequately progress with in-hospital physical therapy and mobility, and therefore the care team may recommend, based on medical necessity, that the patient go to a rehabilitation facility before going home. Before your surgery, you should contact your insurance provider to understand your coverage regarding rehabilitation services. You can also go on the web to www.medicare.gov to get a list of facilities in your area. We ask that you visit rehabilitation facilities in your area and choose 3 you would be comfortable staying in during your recovery. The night before your surgery, Follow the instructions given to you at your pre-surgical appointment regarding showering and cleansing your skin. This is also a great time to place clean, fresh linens on your bed. These steps reduce the number of germs on your skin, which is an important step in preventing infection. Remember, unless specified otherwise, you shouldn't eat anything past midnight on the night before your surgery. On the morning of your surgery, follow the instructions you received during your pre-surgical testing appointment. For example, if you were told to take some or all of your medications, please do that with a sip of water. Remember, eating and drinking too close to the time of your surgery can result in your surgery being canceled to prevent life-threatening complications. And please leave all jewelry and other valuables at home. Also, on the morning of your surgery, arrive at the hospital admissions or registration desk at your designated arrival time, typically 2 hours before your surgery. Allow yourself plenty of time to park and walk in from the parking area. From the admissions or registration desk, you'll be escorted to the pre-op area of the hospital to begin the preparation for your surgery. The nurse will give you a hospital gown to wear and assist you in cleaning your skin. The nurse will also place an IV or intravenous line, which will be used to give you fluids and medications. An anesthesiologist will meet you in pre-op and review your medical history, and then you'll be taken to the operating room. While you are in surgery, your family should wait in the main waiting area or provide the staff with a cell phone number. The staff will keep them updated on your progress. The surgeon will speak with your family once the surgery is complete. After the surgery, you will be moved to the recovery room or post-anesthesia care unit. The PACU nurses will monitor you closely while you are in this area, frequently checking your temperature, heart rate, breathing, oxygen levels, and blood pressure. They'll encourage you to take deep breaths and to cough. This will help to get your lungs back to normal function after anesthesia. They'll also monitor your pain using the 0 to 10 scale mentioned earlier. When all of these vital signs are within normal ranges and you are awake enough to communicate well with the staff, you will be moved to your hospital room. Once you arrive in your room, you will have a care team assigned to care for you. Together, they will monitor your vital signs, provide medications as ordered by your surgeon, encourage you to use your incentive spirometer for breathing exercises, and assist you with your activities of daily living as needed. While you're in the hospital, you'll be served a regular diet as long as you are not experiencing any nausea or vomiting. It is our goal for a physical therapist to work with you to get up and to move around on the same day as your surgery. This will help decrease your chance of any complications. However, everyone responds to anesthesia differently, so the amount of activity you're able to tolerate will be determined by you and the therapist at that time. While we have performed thousands of these procedures, you will likely experience extreme discomfort. Your nurses will be working with you to actively manage your pain, but again, you should plan to be up and walking with your physical therapist on the same day as your surgery. The physical therapist and other team members will continue to work with you on mobility and guide you throughout your hospital stay to prepare you for your recovery phase. Most people are able to go home 1 to 2 days after their joint replacement surgery. To plan and prepare for your continued recovery once you leave the hospital, your care team will be working closely with you to help you meet certain goals so you're ready to be discharged. While you're in the hospital, you'll continue using your incentive spirometer 10 times per hour while awake. These breathing exercises will help keep your lungs clear and active during your recovery. You should be out of bed, sitting in a chair for all of your meals, eating high-fiber foods and drinking plenty of fluids to prevent constipation from the narcotic pain medications. Before you leave the hospital, your therapist will work with you to achieve activity goals, such as walking a household distance and other daily living activities you'll need to be able to do at home. It's a good idea for your coach to be with you on your discharge day so they can learn how best to assist you during your recovery and to help you leave the hospital in a timely manner.
You can do both feet at the same time, okay?
If you have surgery at a Piedmont facility that has group therapy classes, your coach is encouraged to participate in your classes. You will attend 2 group therapy classes per day during your hospital stay. Your therapist will inform you and your coach of your class times. Otherwise, your therapist will work with you one-on-one. Before you leave the hospital, your pain must be well managed, so your nurse will closely monitor your pain and help you develop a plan for pain control once you're at home. Your nurse will also review all other medications and discharge instructions. Your case manager or social worker will make sure you have any equipment, such as a walker or bedside commode, that your surgeon and therapist recommend you use at home during your recovery. Again, most patients recover at home after their surgery. If your care team recommends that it is medically necessary for you to go to a rehabilitation facility prior to going home, your case manager or social worker will communicate with your insurance provider to determine your coverage and options. Insurance providers do not always cover the cost of transportation from the hospital to another facility. So if you have a family member or friend who can transport you to the facility, the hospital staff will assist you with getting to the car. Once you leave the hospital, you should increase the frequency and distance you walk each day. Do the specific exercises you learned 2 to 3 times per day as instructed by your physical therapist. At your physician's request, your case manager or social worker will make arrangements for you to have home therapy visits or outpatient therapy to help improve your mobility and recovery. And don't forget, you will also have follow-up appointments with your surgeon as you continue to heal and improve after your surgery. By viewing this video presentation, you have taken a very important step in preparing for your joint replacement surgery. Our Piedmont team promises to support and guide you every step of the way as you prepare before your surgery, while you are in the hospital, and during your recovery. It is our hope and goal to assist you in returning to independent living and to an improved quality of life. You can find more information about your hip or knee replacement surgery, including additional video presentations, on our website at www.piedmont.org/orthopedics. Once again, we thank you for choosing the Piedmont Healthcare System for your joint replacement surgery.